Hi everyone, my name is Lei Fan. It's a great honor and a real pleasure to be here today. My PhD research focuses on using artificial intelligence, especially deep learning, to analyze histopathology images. It's one of medical images and a kind of doctors used to diagnose cancers and other diseases. So the title of my PhD thesis is Deep Learning for Histopathology Whole Slide Image Analysis. First, let me briefly introduce myself. I recently completed my PhD in computer science and engineering. I was fortunate to be supervised by Professor Yang Song, Professor Akta Somia, and Professor Eric Majorin. During my PhD, I have several research topics and worked on a range of artificial intelligence applications. For example, I had used AI for medical image analysis, like the whole slide images, MRI, and CT imagings. And also, I had used AI for green quality inspections and industry anomaly detection. Next, I will focus on my PhD thesis. It's about using AI for cancer diagnosis and prognosis. Cancers touches many families, such as brain cancer, breast cancer, and skin cancer. I bet you know many people in Australia will develop some form of skin cancer. So, to be sure someone has cancer, a doctor must study a tiny slice of tissue under the microscopy. The problem is we are short on doctors to diagnose all those medical images because doctors need to spend much time on preparing the slides, reading the slides, and making the reports. So patients often wait days, sometimes weeks for a result. But what is whole slide image, or WSI? It starts when doctors take a small tissue sample from a patient and scan it using a microscopy and a computer. This creates a high-resolution digital image of the slide. These whole slide images are incredibly detailed. They capture the microenvironment of cells, including the spatial layout and shape of tumors, all at the cellular level. Because of this, whole slide images have become a key tool in both diagnosing diseases and predicting how they might progress. Teaching a computer to read these slides isn't easy. These images are so large, so they can't even fit into a computer, especially the memory of most graphical cards. It's kind of like using Google Maps. So you can zoom all the ways from a view of the whole city and down to a single horse. This slice is made up of billions of pixels, so it's too big for a regular screen or computer to handle all at once. On top of that, reviewing these images manually takes a lot of time, and because doctors have different levels of experience and expertise, so the assessments can sometimes be subjective. However, interpreting whole slide images by humans, especially doctors, is time-consuming and subjective, mainly because these files are so large. So another challenge is that even hospital uses different devices and microscopes when preparing the whole slide images. So the colors can vary a lot, which makes it hard for AI models to understand. And for some spatial cancers, we simply don't have enough data. Even for experienced doctors, diagnosis can be difficult. That's why developing automatic algorithms is so important. In the next 3 slides, I will show you how we address these challenges. In study 1, we tackled the problem of having too few labels. I designed a model where the computer teaches itself by learning from the rich details in whole slide images without needing human labels. Then we combined all slides from a single patient to generate one overall risk score. This model predicts survival outcomes for brain and other cancers more accurately than previous methods. It also has clinical value. It can help identify key factors affecting survival time and help doctors in making early and more information treatment decisions. In study 2, we looked at a common problem. Slides from different labs and hospitals. They may use different devices and microscopes, and those whole slide images often looked like they have been processed with different, like Instagram filters. So these colors and textures don't match. To fix this, we built a style translation model that translates the frozen slides we call FF into the more standard FFPE slides. So this translation helps both AI model and doctors trust the results more, and it even improves the accuracy of downstream tests like the genetic analysis and cancer diagnosis. In study 3, we trained our AI models using only normal tissue samples, so no cancer cases at all. Then, when the model sees something unusual, it highlights those areas on the slide, so doctors can zoom in and take a closer look. These models are especially useful for spotting unexpected patterns, and we might normally miss, and it also help to find out some special cases. So together, these models can speed up diagnosis from days to just a few hours. They help small hospitals catch up with bigger hospitals, and let doctors focus on the cases, not just the routine ones. So I recommend there are 3 things to remember. AI can read super large slides, And making slides colors consistent really help us. And we now have an early warning system for spatial diseases. Yeah, that's my presentation about my PhD thesis. Thank you so much. I'm happy to take any questions.